dream of easily transportable electronic medical records finally becomes a reality. This will allow patients to easily transmit information from one doctor to another, even if they're different networks and using different record-keeping systems. No matter what system they use, they're all transferable. The new standards will also make it simple for patients to access their own personal health records. I don't want to see mine, please. I don't want to see. I don't know about you. They have all sorts of things, sir. They can tell you exactly what your problem is going to be in 6 years. We can do it. You know, they have all these different things. I don't know if they work or not, but I didn't want to hear it. I didn't want to hear it. If they got a problem, I don't want to know about it right now. But it is amazing what they're doing. I don't know, does it actually work? Can they do that? All right, well then I'm glad I said I don't want to know. But thanks to this announcement, healthcare providers across the country will also finally be able to kill the clipboard. It's an expression that's used, capital, with a capital C, kill the clipboard. Instead of filling out the same tedious paperwork at every medical appointment, patients will simply be able to grant their doctors access to their records at the push of a button. Just a button and you're all set, and all the information the doctor needs will be immediately transmitted.
While Netflix and Airbnb and Uber drivers are racing ahead, making arrangements, identifying the problems that are challenging us in healthcare have become incredibly difficult. You can't make appointments. The average Americans are tired. They're tired of waiting for a doctor's appointment. They're tired of waiting for the surprise of what your hospital bill is going to offer. That's being addressed by one of the president's executive orders. They're tired of waiting for access to their medical records. You own your medical records. They're yours. Why you can't have access to them is a stunning reality in modern day America. They're also tired of waiting for Washington to take action. And this president early on emphatically stated that wasn't going to happen anymore. And today we made that vision into a reality. And there's a fine line between vision and hallucination. What you did today was show it's a vision because you share it with us and we're moving ahead on it. And that's what today's commitments essentially are reflecting. And they are pledges. They're not laws. They're nimble and they're fast and they're quick because the president understands that you, each of you in your own way, understand these needs. And Secretary Kennedy spoke beautifully about the reality of what happens when you actually have electronic records, because what he said is happening in Indonesia, we'll have here. Within a year, on your device, and 91% of Medicaid patients have smartphones. On this device, you'll get insights based on your records if you want. You don't have to take this, but if you desire, Amy Gleason is one of the smartest people I've ever worked with, has built a mechanism to be able to get you that information in a way with all these partners helping so that you can get nudged to pay attention to what you're eating and avoid processed foods. Secretary Kennedy smartly and wisely highlighted is so dangerous to our well-being. All this, by the way, is that will be at the fingertips. In addition, advice about which doctor to see, when to go see them, nudges reminding you why I didn't do certain things. If you're a doctor like me, it's a very different story. It's to help you navigate the system better. It's giving you advice, decision support. The latest breakthroughs. Turns out one of the biggest discoveries is actually this tiny. See how small that is? This little chip may be the next big thing, and it sounds like it's right from a sci-fi movie, but people all over the world are implanting these into their wrists. So I asked my producer, Dean, to find out more about this cutting-edge technology and what it could mean for your health.
And now the Ministry of Health has shifted to the use of biometric verification system for Social Health Authority and the use of the Digital Practice 360 application. This means that patients will no longer use the one-time password authorization method, that's the OTP, to access healthcare at health facilities countrywide. Health Cabinet Secretary Aden Duale says the move is aimed at tightening healthcare verification, curbing fraud, as well as eliminating the misuse of the SHA benefits package. Helen Aura has the details.
This marks the start of the Social Health Authority's biometric system, replacing the recently suspended OTP system.
The government of Kenya, through SHA, is today rolling out biometric identification and verification for all SHA beneficiaries across the country. This innovation will secure access to health services without having physical documents. Your fingerprint will verify your identity securely. This biometric will help us in eliminating fraud.
Health Cabinet Secretary Aden Duale says the biometric system instantly verifies a patient's identity, linking them to their digital health profile, benefits, entitlements, and medical history.
All healthcare workers now have an opportunity to view, to approve, and to manage pre-authorization claims and the services they offer directly through Practice 360 app.
Kenya's past health coverage provider, the National Hospital Insurance Fund, faced massive fraud, losing over 20 billion Kenya shillings in fraudulent claims. Health service providers say the biometric system is long overdue, arguing that the OTP system was unreliable and aided fraud.
Facilities involved in double billing will be suspended.
At the same time, President William Ruto has warned hospitals that are charging for outpatient services at dispensaries, health centers, and sub-county facilities.
Tumeweka pesa ya serikali kwa budget shilingi bilioni 21 ya matibabu ya Wakenya. Kila Mkenya aende kwa health center, aende kwa dispensary, aende kwa level 4, ile outpatient yote. Utatibiwa, utapatiwa dawa, na usilipe chochote kwa sababu serikali ya Kenya itakulipia.
As Kenya strives to enhance its digital healthcare system, health stakeholders are now urging the Ministry of Health to ensure all loopholes that ailed the defunct NHIF are sealed. Helen Aura, NTV.
That the biometric CUR has already been approved in Mexico? Is a new national identification tool that seeks to help in the fight against the disappearance of people. Here I explain what it is, how it works, and why it is so important. The biometric CUR is a renewed version of the unique population registration key. Unlike the traditional CURP, it will integrate biometric data such as fingerprints, a recent facial photograph, the holder's signature, and an iris scan. These elements will allow for much more precise identification and will help reduce the risk of identity theft or forgery. The facial photograph will be taken directly at the civil registry offices along with the rest of the biometric data, all to guarantee its authenticity. In addition, it will include the full name, date, and place of birth. This biometric CUR will be available in physical and digital format and will serve as official identification throughout the country. Its main function will be to improve the search for missing persons, allowing real-time and highly accurate consultations. The information will be integrated into a single identity platform that will connect registries such as the Civil Registry, the National Forensic Data Bank, and other administrative databases, allowing for much faster, safer, and more effective identification. To facilitate search efforts, the law provides for access to this information to key agencies such as the Attorney General's Office, state prosecutors' offices, the National Intelligence Center, and other security agencies. This will allow them to act in a coordinated manner to locate missing persons. In addition, any public or private agency that refuses to share this data will face fines of up to 20,000 times the daily value of the unit of measurement and update. The biometric CUR will be in charge of the Digital Transformation and Telecommunications Agency. It will be mandatory to carry out procedures and access public and private services, both in physical and digital media. Although the law has already been approved by Congress, the executive branch has yet to publish it in the official Gazette of the Federation. The process to obtain the biometric CUR is expected to be available in the coming months, although there is no exact date yet. Do you think this measure will be useful, or does it represent a risk to your personal data? Leave us your opinion in the comments.
The Ministry of Public Security is deploying electronic identification, authentication, and biometric recognition for flight check-ins. Biometric check-in is being introduced in 3 phases. It has already been deployed at major international airports such as Noi Bai, Tan Son Nhat, Da Nang, Phu Quoc, Cam Ranh, Phu Bai, and Cat Bai. By mid-September, it will be expanded to 11 more airports. From the beginning of 2026, at least 70% of domestic passengers will check in through automatic gates using biometric technology, aiming to apply synchronously nationwide.